Aloha! I'm Dr. Ritabelle Fernandes from the University of Hawaii. Thank you for taking the time to improve dementia capability in our state. CHWs play a very important role in providing caregiver education. CHWs have earned the trust of the community, which makes families more receptive to listen to their advice. Please think outside the box when identifying the care team. It does not have to be just one person, but rather can be a person to help with specific tasks or activities. It does not have to be a family member or even a close friend. Remember, it takes a village to help a person with dementia. Caregiving takes its toll. Caregivers are at risk of health problems, feelings of social isolation, risk of depression, and financial burden due to lost wages and the high cost of care. The healthcare system would not sustain the cost of care without unpaid caregivers. Providing support for dementia care partners is critical. Assess caregivers' understanding and acceptance of the patient's diagnosis. Answer questions and address any barriers to care. CHWs could provide simple dementia education, such as this beautiful handout, 10 Ways to Love Your Brain. CHWs could also educate families on the importance of brain health and fitness. Encourage seniors to challenge their minds by playing games of strategy. Encourage regular exercise. Studies have found that physical activity reduces the risk of cognitive decline. Caregivers need to be informed of healthy nutrition. The MIND diet stands for Mediterranean-Intervention for Neurodegenerative Delay, and this has been shown to improve cognition. Please see the accompanying handout and give these to families and caregivers. Some seniors may need to be referred to Meals on Wheels program or the Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps. Let's move on to discussing how to best communicate with persons with dementia. This can be a huge challenge. Best practices recommend speaking slowly, using short, familiar words, asking one question or giving one direction at a time, redirect, breaking down complex tasks into simple steps. Most importantly, avoid arguing or disagreeing. We need to be mindful of our facial expressions, eye contact, hand gestures, tone, touch, and tenderness. Most experts agree that 70 to 93% of all communication is nonverbal communication, and only 7% is verbal. Words do not matter so much. How we give information is also important. remember to follow the order of show, tell, and then touch. For example, I might say to a client, "Hi, I'm Dr. Fernandes. May I please listen to your heart?" Only after they have seen me and heard me will I proceed to touch the stethoscope on their body. If I directly examine them without prior visual or verbal cues, the person with dementia might hit me. When starting a conversation, come from the front. Identify yourself and keep good eye contact. If the person is seated, please go down to that level. Call the person by their preferred name. Use short, simple phrases and repeat information as needed. Ask one question at a time and wait patiently for a response. Remember, all behavior is communication. One needs to think like a detective to figure out what is causing the troubling behavior. The who, what, when, why is all important. One technique is to break down the tasks into simple, easy to understand steps. Let's look at the example of taking a shower. A caregiver might say, "Mary, take off your clothes. Step over here. Turn on the faucet." And so on. These simple steps help the client. Remember, in the early stage of dementia, a person can still perform complex tasks. But as the disease advances, we need to greatly simplify or modify the task. This does not mean just leave the person with dementia in their room all day. Rather, we should adapt activities to suit the needs and capacity of the person. Let's look at this example. What time is my mother coming? You know that Ken's mother died 20 years ago. Which response is better? A. Your mother is dead, Ken. Your sister will pick you up at 4 p.m. Or B. She'll be here in a little while. Let's get a dish of ice cream while we wait. Today's best practice in dementia care makes B the correct choice. Never argue with a person with dementia. Caregivers often ask me if quizzing their loved ones will help keep the brain strong. Unfortunately, no. Quizzing will only increase frustration and anxiety. A better technique is to reminisce together. Go through the photo albums, scrapbooks, and listen to the elders' stories. Another strategy we can teach caregivers is the validation approach. This approach focuses on empathy and understanding. It is based on the principle of validation, acceptance of the reality and personal truth of a person's experience, no matter how confused they may be. This can reduce stress, agitation, and the need for medication. Let's look at this example. John is very upset and says, "Who stole my book?" Many caregivers' instinct might be to persuade the person that the book was likely not stolen and has just been misplaced. An adult with dementia may not be able to comprehend the difference. It is more important to ease the agitation of the adult than to help the adult understand that the book may have not been stolen. This is validating the adult's feelings. Another technique, distract and divert. It works wonders. Never focus your attention by saying, "No, don't do that." Provide food, drink, or rest. These can be a form of redirection. If you have the fine privilege to visit a person's home as part of your CHW role, please pay close attention to the home environment. Look at the lighting, the cues, noise, and clutter. Maximize location and function by using pictures and contrasting colors. Let's look at this toilet. In the picture on the left, everything is white in color. A simple, easy fix is to have the toilet seat in a different color. Safety is a big concern for persons with dementia. If there are areas you do not want the adults using, then blend the doors and walkways by using the same color or creating a mural such as a shelf of books on the door. This makes it less likely that the senior will use the door or walkway, but it is still available as a safe exit for others. Listening to and performing music reactivates areas of the brain associated with memory, reasoning, speech, emotion, and reward. Research has shown that music can boost memory and mood. If you have not watched this documentary, I highly recommend watching Alive Inside. Establish consistent routines can be calming and reassuring for both the person with dementia and those around them. Concepts like normalization mean something different within this disease. If a toy or soft bear helps to comfort the senior, then it should be encouraged for the individual. Bottom line is to focus on the remaining abilities, not on the losses. Remember, the glass is half full, not half empty. Moving on to part 3, community resources. I would like to begin with safety. If you are concerned about falls, please request the healthcare provider to make a referral to physical therapy. A physical therapist can perform a home safety evaluation and determine the appropriate durable medical equipment that is needed. If you have a client who is at risk for wandering, please enroll in the Alzheimer's Association 24/7 Wandering Support for a Safe Return. The cost is approximately $50 and a $25 annual renewal fee. In this program, first responders have a photo and details of the client and can search for them right away. Please tell caregivers not to prevent movement. Educate them not to use restraints. Recommend, rather, adding meaningful activities such as music, dance, and rhythm. If you are concerned about driving, then the Alzheimer's Association Driving Center resource has some great videos. Hartford has a booklet for families called At the Crossroads. As a last resort, the family may need to take away the keys. We need to inquire about firearms. Hawaii is not a hunting state, but some people own firearms, which is their Second Amendment right. Make sure the guns are stored unloaded in a locked cabinet. Inquire if there were any guns gifted or borrowed by friends or families. Remind caregivers to store ammunition separately in a locked, fireproof case. Seniors with dementia are often at risk for financial abuse. A representative payee could be assigned to help with paying the bills. CHWs also need to ask clients if they have ever burned pots and pans while cooking. During your home visit, inspect the kitchen and look for presence of smoke detectors. Having a plan for home and personal safety can bring peace of mind. Encourage emergency preparedness. We are living on an island with the risk of hurricanes or tsunamis. Make sure there is a fire plan. You could ask the client, what would you do if there was a fire at your house? Have a hospital medical emergency kit at the bedside. Encourage lifestyle changes that may reduce disease symptoms or slow progression. Share the handout 10 Ways to Love Your Brain. CHWs could facilitate regular physician appointments by offering reminder calls or arranging transportation. I do understand that CHWs are often not comfortable with medication management. A simple and effective strategy could be to encourage clients to use a pill box. An appointment log encourages families to plan ahead for doctor's visits by writing down the top 3 concerns they'd like to address with the doctor at the visit, taking notes during the visit, and writing a to-do list of doctor-recommended actions. People can live alone safely in the early and middle stages of the disease with the right supports. The key is a good assessment and reassessment plus planning, home modifications, technology, and connecting to community resources and supports. Assistive technology is very useful for persons living alone. There are GPS wristbands, home monitoring devices, and so much more. I recommend a personal emergency response system, PERS, to all my clients living alone. This is an alarm system designed to signal the presence of a hazard requiring urgent attention and to summon emergency medical personnel. Encourage clients to assign a durable power of attorney. There is always legal aid for persons who cannot afford an elder law attorney. Encourage families to talk about long-term care and when they would access support. Encourage families to complete an advance health care directive for their loved ones with dementia before it is too late. Connect families to community resources. Please share these numbers. The Alzheimer's Association is a one-stop shop for care consultation, support groups, and 24/7 helpline. They offer caregivers opportunities for online training and dementia certification. Public health nurses are registered nurses who can support clients with dementia and their caregivers in navigating the healthcare system. The referral form can be found in the handouts. Public health nurses perform home visits free of charge. Home health agencies provide physician-ordered short-term rehabilitation services to homebound seniors at home. This is covered by medical insurance. You can have physical therapy, speech therapy, occupational therapy, and skilled nursing at your home. Please think of hospice for clients with advanced dementia. Services include a team of nurse, social worker, chaplain, and home health aide that provide care in the home. This is fully covered by medical insurance with little or no copay. Seniors living at home who have problems with 2 or more activities of daily living could apply for Kapuna care. Often there is a wait list for these services, which include case management, attendant care, personal care, meals, and transportation. Please call the ADRC at 808-643-ADRC or visit their website at www.hawaiiadrc.org to make a referral. Medicaid in Hawaii is offered through managed care organizations such as HMSA. If approved by the service coordinator, a person with dementia might qualify for home and community-based services. The VA has many services to offer veterans with dementia. However, the first step is that clients need to be enrolled in the VA health plan. What I have shared today is nicely summarized in this roadmap, which you will find in the handouts. Please keep a copy with you. It will help with case management and navigating the current healthcare system. CHWs play a vital role in creating age-friendly health systems and communities. By performing cognitive screening, you will assess the mentation. The 4 M's are what matters, medication, mentation, and mobility. Remember, healthcare is an art, not a science. Big mahalo to each and every one of you for advocating for your clients. Mahalo to the Administration on Community Living, University of Hawaii Center on Aging, and the Executive Office on Aging for sponsoring this video.